What treatment medication is available, and how will I know what's best for me?
Okay, there's two main sorts of treatment medication in Australia. Both of them act like opiates, so they act like heroin, although both of them are much longer acting. So that's methadone and buprenorphine. The way that they work on your system is essentially we give you the opiates so you don't have as strong a need to go and find heroin or other opiates. That's essentially how they work. They work as replacement sort of type drugs.
Methadone comes as a liquid, which is known as methadone syrup or biodone. They both come in the same concentration, which is 5 milligrams per mil. Neither of them contain sugar. Methadone is taken orally, swallowing it once a day. That's because methadone lasts about 24 to 36 hours. Buprenorphine comes as little sublingual tablets. They're tablets that have to dissolve slowly under your tongue. If you swallow buprenorphine, it doesn't work. The other differences are particularly at the beginning of treatment. So methadone, because it's a full agonist, which means as you increase the dose you get more of an opiate effect, can kill people if you give too much of it to them. And that means during induction, we start on a low dose, normally 20 or 30 milligrams, and we gradually build that up, normally at a rate of 5 milligrams every 4 to 5 days, to a dose of around 60 to 8 milligrams. It can take several weeks to get you comfortable on methadone. Buprenorphine is a different drug. It's known as a partial agonist, which means as you increase the dose of buprenorphine, you don't increase the opiate effect. What you increase is the duration of action. That means that people on bigger doses of buprenorphine can get dosed every 2 or 3 days.
Another issue with choosing what kind of pharmacotherapy in terms of positives and negatives, with buprenorphine you can get up to your maintenance dose within a period of days essentially.
The fact that methadone at bigger doses is associated with respiratory depression means that methadone is much more dangerous in overdose than buprenorphine. Both drugs, however, particularly if you inject them and particularly if you mix them with other drugs like benzodiazepines or alcohol, can also cause fatal overdose. What's really important though is the dose of both medications. For methadone, its doses of 60 to 80 milligrams at least per day are associated with better outcomes. For buprenorphine, its doses of 12 to 16 milligrams per day. The other difference is actually the effects that you might feel. So bigger doses of methadone make some people sedated. If you want to feel slightly more clear-headed, buprenorphine might be better for you. Finally, methadone is affected by lots of other drugs in terms of its metabolism and the way that it works in the liver. For buprenorphine, there's much less interaction. So if you're on other medications, you might want to think about buprenorphine. Suboxone is a drug that's recently been released in Australia and is a combination of buprenorphine and naloxone. So this is an 8 milligram buprenorphine tablet. It's only got buprenorphine in. This is an 8 milligram tablet of Suboxone, a combination of buprenorphine and naloxone in a ratio of 4 to 1. If you take Suboxone as directed, sublingually, It will work exactly like buprenorphine. The reason that naloxone was added to buprenorphine was to reduce its desirability as an injectable drug. You take Suboxone as directed, you effectively just absorb buprenorphine. So taken as directed, this tablet and this tablet are pretty much identical. However, if you should choose to inject Suboxone, what you're going to get is 100% of that naloxone. Naloxone is that drug that we give to people who have overdosed. And although buprenorphine itself will precipitate withdrawal in someone who has got opioids already on board, injecting Suboxone will be that much more aversive because naloxone is going to kick the opiates off those receptors in your brain and put you into really bad withdrawal. So really, neither of these drugs should ever be injected, particularly when they've been diverted from somebody's mouth, because you're not injecting just their buprenorphine or Suboxone, you're injecting a bit of their lunch, and bacteria, fungal, all that sort of stuff. But the, I suppose, practical importance of Suboxone is certainly in some states it's going to allow for an increased availability of unsupervised doses. And that means for stable clients, that means far less restriction on their daily activities and a greater opportunity to engage in activities such as work, parenting, education.
So for both methadone and buprenorphine, it's important that it's the right drug for the right person at the right time in the right dose.